Hi, this is Dr. John Harper from beautiful Oceanside, California, and I'm here with Mary Lou Dougherty, and she is kind enough to help us make this video today, and she's going to tell us a little bit about her experience before coming to our office and what made her come and how she's been doing since. So Mary Lou, tell us a little bit about some of the issues that you were having before we met you.
Well, peripheral neuropathy, the bottom of my feet, the lower back pain, sciatica, pain down the leg. Balance was an issue.
And then
thyroid, thyroid.
Right.
Yeah.
And then you had some mid back issues,
yes.
right? Yeah, you have compression fractures
yes,
there. They've been there for a while, and that was bothering you quite a bit.
Since 1983.
Oh boy. And so and this was limiting your ability to do things, I guess, like dancing and some of your exercises and
yes.
Is it yoga, I guess, that you do, or
yes,
some
I
posture
do yoga.
things?
Yeah.
And this was causing some grief with those areas and
right.
wasn't working too good.
Right.
So so what did you try before coming to my office for these issues?
Well, I've had back surgery for my lower back, and that worked for a while until I was a little overactive, did too many things too quickly, so I'm kind of back to square one. And
you said you tried chiropractic before?
Chiropractic treatments, yeah, and they would help. However, it wouldn't hold.
It was temporary. It'd feel good for a while. And
it
then
was
come
something
back.
I'd have to do on a monthly basis, sometimes twice a month, and feel good for a while, and then depending on how you're walking, sleeping, sitting, gardening, whatever, then it goes back to square one again.
Okay. And so how did you happen to find out about us?
An advertisement, a flyer from Fraser Farms.
Okay.
And it was the workshop, I believe, on the thyroid gland.
Good.
And I thought, let me check it out.
Okay.
What have I got to lose?
Very good. And what was it about the workshop that made you decide to see if you were a candidate for our recovery programs?
Well, you, Dr. Harper, had the same problems I did. Weight control, lack of energy, balance problems.
Yeah, I'm scheduled for back surgery too.
Oh, were you really? Wished I'd have found this before I had my surgery.
Yes.
And let's see, what else? The weight gain, the balance, the depression.
Yes. Yeah.
No energy. When you're retired, I was of the opinion naps are mandatory.
Right.
Now I go through the day without naps.
Fantastic. Good.
Lots of energy.
Very good. So when you came in here, how would you describe that experience? How did we treat you? How thorough were we?
Well, it certainly wasn't anything I'm used to in a doctor's office. They bend over backwards to make you feel welcome, glad to see you, and the exam was very thorough and very personable.
Oh, very good. And as far as our explanation and the giving you all the paperwork and explaining the care and the program, the finances, all that was really clear for you?
Yes, very much so. Yeah,
Great.
Nothing was left to chance, so to speak.
Excellent. And now, how long have you been here in the office?
I believe it was April the 7th or the 8th.
Okay,
so about, I don't know, 12, 13 weeks now.
Very good. So tell us about the mid-back, the peripheral neuropathy, the balance. How are all those things doing? The sciatica?
Well, the neuropathy went away in a matter of a couple of treatments. That was it. The balancing of the brain is good. Let's see, what else? My balance, I can do things now in yoga, such as stand on one leg, that I couldn't do before.
Fantastic.
And
how's the back feeling?
Yeah, the pain in the back. The upper back, I don't very rarely have pain there anymore. And the lower back, the only time I get pain is if I sit around all day doing nothing, reading, watching TV,
yes.
and going to bed early and staying there for 9 or 10 hours.
Okay, and what did Dr. Harper say about those things?
Don't do it.
Okay, very good. All right.
Then I do my exercises, my stretches and whatnot that he has given me to do, and that I don't have to take pain medication anymore on a daily basis.
And so one of the things that you told me after a few weeks is that you went out and started dancing again. And that I wasn't really happy, but then I was really happy. So that's really great. And so the joy that I have is people getting back to doing the things they want to do. That's really fun.
And I even did some gardening about 2 weeks ago.
Fantastic.
On my hands and knees, redoing my
Wow.
papers.
Wow. And you didn't pay the price, did you? You were able to just enjoy life and go from there. Fantastic.
I didn't get up. It wasn't one of those that takes you 5 minutes to get up off the sidewalk, you know.
Fantastic. Good for you. So, Mary Lou, one of the main reasons why I do these videos is because, people are very skeptical. They something that steps out of what they're used to seems to be strange or even wrong. If somebody was skeptical about coming in here to see if they did qualify for a recovery program, what would you say to them?
Definitely do it. However, pay attention to what Dr. Harper says and do exactly what you're supposed to do. There's going to be a little margin of cheating. Especially if you're in a restaurant, you don't have your regular, your stevia or the right kind of cream, that can't be helped. So, and then when you do cheat, you feel guilty. Oh boy. And, but if you follow everything that Dr. Harper says, you're not going to have a problem. You're going to feel better in no time. And several people I've done a few treatments with in some of the rooms would ask me, well, do you feel any different? And I say, yes, I do. And in the beginning, it's a little slower, just like the weight loss. I lost 10 pounds.
Very good.
And the weight loss, you don't weigh, unfortunately, Dr. Harper doesn't have a magic wand.
Yeah. Yep.
He waits to bring that out towards halfway through your sessions.
Okay.
And you actually start seeing a difference. I no longer crave sugar. I no longer crave wine. I don't crave toast or bread or sandwiches, and it's just amazing. I rediscovered how to cook.
Very good.
Everything does not have to come out of a box.
There you go. Beautiful. Well, very good. Well, thank you, Mary Lou. I really appreciate it today. This is going to be very helpful for people who are interested in taking a look at us. With all that, I just want to say thank you very much and have yourself a great day.